Well, this is the class Pathophysiology, and we are reviewing chapter 12, liver, gallbladder, and pancreatic diseases and disorders. Let's start with the anatomy and physiology. The liver is the largest solid organ. Plays role in digestion, mostly of fats, absorption, metabolism of nutrients, blood clotting, manufacture of chemicals like bilirubin, and storage of nutrients. The gallbladder, that is a component or a part of the liver, lies just under the liver, stores bile until needed. The bile is kind of a fluid that contains the fat that digested by the liver. Pancreas. The pancreas is another organ that lies behind the stomach, produces and excretes most intestinal enzymes. Well, as you know, the pancreas secretes insulin, that is the hormone in charge of maintaining a certain level of glucose in the blood, a normal range. So the insulin, what the insulin does is take out glucose from the blood, decrease the level of glucose in the blood. And the pancreas also secretes glucagon, that is another hormone that the function of the glucagon is the opposite of the insulin, is increase the level of glucose in the blood. But the pancreas also, it lies behind the stomach for a reason. The pancreas secretes directly to the small intestine some enzymes that help in the digestion of the food. Pancreatic enzymes. Common signs and symptoms of diseases that involve the liver, gallbladder, and pancreatic, and the pancreas. For example, the liver disease or jaundice is one. Gallbladder and pancreas disease have as a sign or symptom pain. That is the most common symptom. For liver disease, the most common symptom is jaundice. For diagnostic tests, the liver function test measure bilirubin, albumin, and that is a protein, and alkaline phosphatase. You have also ultrasound to check these organs, X-ray, CT scan, biopsy, and blood test to measure pancreatic function, to measure the level of pancreatic enzymes and also liver enzymes. Liver diseases now. Liver diseases can range from mild inflammation to those that destroy the liver and result in liver failure, like hepatitis A, hepatitis B, hepatitis C, alcoholic damage to the liver, or alcoholic hepatitis. Also, you have let's describe what is hepatitis. Hepatitis is the inflammation of the liver. The causes can be chemical actions of drug or toxic substances. You know, every substance, every food, every medication, every drug is synthesized or crosses the liver. So also can affect the liver chronic alcoholism, group of viruses, like I mentioned before, the different hepatitis A, B, and C. That is the most common cause of liver diseases. Hepatitis can be a viral hepatitis, most relevant disease in the world, most prevalent, not relevant, most prevalent disease in the world is hepatitis. It's asymptomatic to vague symptoms, to symptoms that are not too strong. You have 5 types of viral hepatitis: A, B, C, D, and E. Hepatitis A is benign, is spread by oral fecal contact, so food that is contaminated. Liver diseases, hepatitis B is formerly called serum hepatitis. It's spread by blood, urine, feces, saliva, and semen. It's considered a sexually transmitted disease. It's 100 times more infectious than HIV. Hepatitis C is spread by blood or sexual contact, progresses very slowly, and is usually chronic. Hepatitis D is the Delta virus that requires presence of hepatitis B to replicate. Continuing with liver diseases, hepatitis E is spread by oral fecal contact, commonly due to water contamination. The symptoms are jaundice and liver enlargement, malaise, anorexia, fever, myalgia, and abdominal pain, dark color urine, clay or light color stools. The treatment for hepatitis is rest, good nutrition, and antiviral medication. Antiviral medication. For prevention, good hygiene, special care when handling needles and body fluids. Another liver disease is cirrhosis. It's chronic, irreversible, and degenerative, also known as end-stage liver disease. The replacement of normal liver cells with non-functioning scar tissue happens with cirrhosis in hobnail liver. Cirrhosis is the most common cause of cirrhosis is chronic alcoholism. The symptoms are loss of appetite, nausea, indigestion, weakness, and weight loss. The complications of cirrhosis or of severe cirrhosis are portal hypertension. The portal is the system of circulation special for the liver, arteries and veins that works for the circulation of the liver specifically. Another complication is esophageal varices with caput medusa, splenomegalia. Caput medusa is related to the shape of these varices in the esophagus. Splenomegaly, gastrointestinal hemorrhage, hematemesis, ascites, edema, and jaundice. Complications of severe cirrhosis continue. Altered sex hormone metabolism happens that causes gynecomastia, palmar erythema, spider angiomas, female hair distribution, testicular atrophy, hepatic encephalopathy, and delirium tremens. Liver cancer is primary and benign tumor of liver rare, usually discovered late or end stage. The diagnosis is made by biopsy. The treatment is radiation, surgery, chemotherapy. The prognosis is very poor. For gallbladder diseases, cholecystitis or cholecystitis, you got inflammation of gallbladder, usually caused by obstruction of bile due to gallstone. The symptoms are pain in the upper right quadrant of the abdomen. The diagnosis by ultrasound or cholecystogram, One complication is rupture of the gallbladder leading to peritonitis. The treatment is surgical removal called cholecystectomy. Continuing with gallbladder diseases, cholelithiasis. Cholelithiasis is gallstones in gallbladder or bile ducts. An important risk factor called the 5F. The 5Fs of cholelithiasis: female, fair complexion, fat or obese, fertile or has children, and 40 years of age are risk factors for cholelithiasis or gallstone in gallbladder or bile ducts. The symptoms for cholelithiasis are nausea, vomiting, RUQ pain following meals with fat. Here is where happens the cholelithiasis, the gallstones in the gallbladder, and they can obstruct any of these ducts here. Here is the liver and a small bile duct, the hepatic duct, the cystic duct after the gallbladder, the common bile duct here, the duodenum or the small intestine here. Here you can see the connection of the pancreas connected through these ducts to the small intestine. The first part of the small intestine is the duodenum, the first segment. Like let's say the first 7 meters, 7 meters of the small intestine. Not meters, 7 inches. The small intestine is around 20 inches long. So the main thing here is that when one of these ducts is blocked with a gallstone that is formed here, this causes pain to the patient. That's why sometimes you gotta get rid of the gallbladder, like cut it completely, so you don't have these problems of gallstones. When I was doing a research project in one of the most recognized universities in New York, very recently, we checked every patient for gallstones and problems in the liver, because for testing new medications with patients it's too risky to do this type of activity of research with patients that have problems in the liver. Continuing with pancreatic diseases, pancreatitis is the inflammation of the pancreas. It's commonly caused by alcoholism. The symptoms are severe abdominal pain radiating to back, nausea, vomiting, diaphoresis, and tachycardia. Pancreatic diseases, pancreatitis. For pancreatitis, the symptoms of chronic pancreatitis are similar to acute. The diagnosis is diagnosed by high blood amylase in the blood. The treatment and prognosis depend on cause. It can be gallstones, and the solution is cholecystectomy. Can be idiopathic, that can be contrasted with a palliative symptomatic treatment, or because of alcoholism, that can be also have a palliative treatment and a symptomatic treatment. Also, another way to treat the alcoholism, the pancreatitis because of alcoholism, is quitting drinking alcohol. This will not cure pancreatitis, but it can help. Pancreatic cancer, usually adenocarcinoma occurring in head of pancreas. The cause is unknown, but carcinogens include cigarette smoking, high coffee consumption, chemical exposure, and consumption of high-fat diet are causes. Symptoms are abdominal and back pain, nausea and vomiting, loss of appetite, weakness and fatigue, and jaundice. Pancreatic cancer. The diagnosis is by biopsy. The treatment is surgical resection, radiation, and chemotherapy. The prognosis is very poor. A patient with pancreatic cancer, the prognostic for life is very, very poor. It's a very difficult disease to survive with. Rare diseases in these organs, liver, pancreas, gallbladder, are, for example, primary biliary cirrhosis, that is a chronic liver disease that gradually destroys bile ducts in the liver. Gilbert syndrome, that is a congenital liver disorder. Hemochromatosis, that is when the body absorbs and stores excessive amount of iron. And the effects of aging on the gallbladder, liver, and pancreas are an increased seriousness of infections. Lifestyle risk factors contribute to health outcome, increased bile stones, and decreased pancreatic enzymes. So digestion is sometimes more difficult for older people. Well, this was the PowerPoint for the class of today. Pancreatic, gallbladder, and liver diseases and disorders. Let me finish the recording of this PowerPoint to continue with the class of today.